Hi everyone, I am Shahan. Welcome back to my channel, and in this video I will tell you about the drugs which cannot be used in pregnancy and the drugs which can be used during pregnancy. Number one is antiemetics, that is the drugs which are used in morning sickness, vomiting, etc. So which drug we cannot use? Domperidone, ondansetron we cannot use. But which drug we can use? One is doxylamine, dicyclomine, metoclopramide, promethazine. All these we can use. Metoclopramide, doxylamine, dicyclomine, all these. Promethazine we can use. Cyclizine we can use. Next come the drugs for peptic ulcer and GERD. For peptic ulcer and GERD, we cannot use, or we should not be using, omeprazole, pantoprazole, lansoprazole, cisapride, mosapride, cimetidine. We should not be used. Then what we should be used? We should be using ranitidine, famotidine. Next comes laxative, which is used for constipation. Which drug we should not be used? Like senna, bisacodyl, saline purgatives, or docusades. All these we should not be using. But what we should be using? We should be using dietary fibers, isabgol, lactulose. We should be using this. Next is antidiarrheals. In diarrhea, we should not be using loperamide. We should not be using. And we should not be using diphenxyl atropine. All these drugs we should not be using. But we can use oral rehydration salt. Next is analgesic, like for headache, body ache, joint pain, visceral pain. We should not be using aspirin. We should not be using NSAIDs, COX-2 inhibitor, codeine, morphine, pethidine, tramadol. We should not be using all this. But what we should be using is paracetamol, ibuprofen. All these we can use. Paracetamol and ibuprofen, if you are using, we should be using it in low dose. Next is cold cough remedies. Cold cough remedies, we should not be using codeine, dextromethorphan. We should not be using, dextromethorphan, bromhexine. We should not be using codeine. We should not be using. But we can use xylometazoline, oxymetazoline, budesonide, chromoglycate, all these nasal drops, nasal drop composition, xylometazoline, oxymetazoline nasal drops. These nasal drops we can use in cold cough remedies. Next is antiallergic. In antiallergic, we cannot use cetirizine, loratadine, acetamizole. We should not be using. Fexofenadine we should not be using. Then what we should be using allergy? We should be chlorpheniramine and promethazine. Chlorpheniramine and promethazine we should be using. This we can use. Next is antibacterials. Systemic bacterial infection. What we should not be using is cotrimoxazole, tetracycline, doxycycline, chloramphenicol, gentamicin, streptomycin, kanamycin, tobramycin, clarithromycin, azithromycin, clindamycin, vancomycin, nitrofurantoin. We should not be using all these drugs. But what we can use is penicillin G. We can use ampicillin. We can use amoxicillin clavulinate. We can use piperacillin. So basically penicillin, piperacillin, and coamoxiclav, all this we can use. Erythromycin we can use. Cephalosporins we can use. Next is antitubercular drugs. Which drug we should not be used? Pyrazinamide, ethambutol, streptomycin. We should not be using this drug. But we can use these drugs like isoniazid, rifampicin we can use. But streptomycin we should not be using. Ethambutol, pyrazinamide we cannot. But only you can use rifampicin and isoniazid. Next is antiamorbic, Antiamorbic, we cannot use metronidazole, tinidazole, all this we cannot be used. Especially tinidazole cannot be used, okay? Antiamorbic. But we can use, for antiamorbic, we can use diloxanide furoate. Diloxanide, we can use this. Antimalarians, we cannot use quinine, mefloquine, artesunate, artemether, primaquine. We cannot use all this. But we can use chloroquine. Remember, we can use chloroquine. And we can use proguanil. Chloroquine, proguanil we can use. Next is antihelminthic. Antihelminthic, we should not use albendazole, mebendazole, ivermectin. All these we cannot use. Okay? Praziquintal we cannot use. But we can use piperazine niclosamide. So piperazine niclosamide we can use. So this is the end of this video. If you like this video, make a thumbs up and please subscribe our channel.